Thank you, Dr. Samina, and thank the organizers for this opportunity. So, what is a safe hospital? So, whatever Dr. Muscati said, this is the opposite of that. Safe for the patients, safe for the doctors, and safe for the community. So, basically, how to improve the safety? I love this statement. Every system is perfectly designed to achieve exactly the results it gets. If you design a system for mediocrity, it will give mediocre results. If the infrastructure is perfect, it will give perfect results. So basically, the quality system based on these three premises: structure, process, and outcome. And these are the elements of safe hospital with good infrastructure. We have structural component, basically the pillars and RCC, non-structural component with lifeline facilities, medical facilities, and the architectural elements, the functional component. Apart from this, there are emergency exit system, fire system, electric system, which we don't really see on. So this is a basic of power optimization. We need to have good medical grade power strips and critical power units, what Dr. Muscati just mentioned: facility power, condition power, backup power, efficient power, and then monitored power. The second aspect is communication efficiency. Every clinic or hospital need to have this good communication system in place. Healthcare communication is highly varied, not singular like our household communication system. You need a lot of bandwidth, you need landlines, you need hired lines, leased lines, and if you have a EMR, you also need good crowd support. You also need to have systemic vision. Apart from the inputs, you have to have this processes in place, right from admission to treatment, and then if the processes are good, your outcomes also will be good. So work on these lines: inputs, processes, and outputs. If your input is good, naturally you get good outcomes. Follow the customer needs. It's very important. Customer goes through a journey in your hospital, right from arrival to discharge, and you have to take care of his needs first. This is not only patient needs, you also need to take care of the family's needs, owners or the management needs, community needs, and our own staff needs. You also need to take care of the patient flows. Patient flow is should be like a river in your hospital. When the system works well, patient flows like a river. But when it is not there, it becomes a reservoir where mosquitoes also breed. So you should monitor time taken for care delivery in each and every care process zone. The other aspect is patient safety. A lot of common errors do happen in our day-to-day work. Common errors are surgery, leaving the tools in operating on wrong part of the body, wrong eye, infections acquired in the hospitals, and also operating on the wrong site or wrong eye. Wrong surgery, wrong eye, it's quite common. You need to have a good quality management system in place, whether ISO, NABS, JCI, whatever it is. See to that the standards are implemented and integrated very well into all the processes of the hospitals. You also need to take into do a proper internal audit and work on that internal audit continuously. So internal audit should lead to good corrective action and preventive action. We will not go into details of this, but you need to have written policies and see to that your staff learn that and abide by that. The internal audit process is a basic need for all quality management system. It is also necessary to follow all your assets, temperature and humidity monitoring, patient and staff safety, link it basically to your Wi-Fi, or if you have a good LAN to that, to the patient flow. If everything is linked, managing all these things are easy. Otherwise, every day you will be losing some of your assets and it's very, very difficult to manage. EMR manual, ideal to have a good EMR in place with all this system in place for managing your assets. This is one system with manual. There is only few errors found, but when you have a good EMR with robust reporting mechanism, you can always find so many errors about wrong dosing, wrong prescription, whatever it is. Another safety aspect is to the doctors and to the hospital is avoiding the medical legal problems. So most often it is problems are related to the administrative errors like tariff or billing, and then failure to comply with legal. These two are important aspects of running a safe hospital. Comply possibly with all the regulatory requirements. and it's very important now. If you are earning money, you also pay tax and earn peace of mind. So these are so many taxes for us. I will not list them down, but it will take another one instruction course for us to list all these regulatory requirements with reference to tax. Apart from this internal environment, you also need to take care of the physical environment, legal constraint, and the external environment. One external environment of late becoming a headache as well as nuisance for all the hospital owners is the advent of internet. People have become internet savvy, so beware of the contents being generated for your hospital as well as against your hospital in the social media. Whether you like it or not, it is here to say, have a frequent watch on social media about your feedback, not your own pages, about the feedback of your hospital. It's very important that your website is updated, and these 4 things are important. Manage short-term crisis so that it doesn't lead to long-term crisis. This is very, very important and urgent. Focus on long-term strategic goals. Avoid distractions in your practice time. So if you are seeing patients, see only patients, and limit time wasting activities which are not important and not urgent. And you also need to have, now patients are customers. If there is a problem, you also need to have this system in place, service recovery program. Hear them, empathize with them, apologize if there is something wrong, respond immediately, and thank them that they raise the flag in your facility. Beware of these 3 P's: police, press, and public. You need to have a real communication backup and system backup if you are running a hospital, because these 24/7 news channels are really after us to get content, whether it is for ethical reasons or unethical reasons. So beware of this important 3 points. They have a strategy in place to deal with police, press, and public in the name of mob. So you also need to learn certain communication skill, because most successful doctors are those who have good communication skills. You also need to really learn how to break bad news. So the house of safe and best medical practice is based on these structure, process and outcome. Apart from that, there are ancillary protective roof of quality based on these 7 premises: efficacy, effectiveness, efficiency, safety, legitimacy, and equity. You also need to learn about or enhance your culture within your organization, take care of your human resources. You need to learn the nuances of leadership and also learn person-directed services. If you have these systems and a safe mechanism in place, you'll be really having a safe and good practice. Leadership is for everyone. So everyone wants to succeed, but few are willing to put in. So stop limiting yourself. You can learn all these talents. You can gain all these talents. It will only take one person to believe that it's possible. It will only take one person to put in the work, and that person is you. A professional organization is one in which extraordinary systems enable even people with ordinary skills to produce extraordinary talents. Even though you have a very small team, you can always get good results and have a safe practice if you practice all these things. Thank you so much.